Hello, I'm Peter Ndoro, and welcome to this week's edition of Health Talk. Eye Care Awareness Month is celebrated in September, and World Retina Day is on the 28th of September. So, what's coming up on the program today? We'll be listening to an interview done by producer Wandile Mfokeng. He spoke to the head of science at Retina South Africa. She was diagnosed with retinitis pigmentosa, and that's a rare inherited eye disorder. We then speak to a specialist ophthalmologist about diabetic retinopathy and cataracts and the impact of COVID-19. And later in the program, a GP gives us some advice to COVID-19 patients that have had to resort to social media to share their frustrations about dealing with COVID-19 symptoms. And we want to give them the best advice, because sometimes on social media you just hear from the wrong people and get the wrong advice. But first, let's catch up with Zama Buthelezi. He'll take us through the latest South Africa COVID-19 numbers, and I hope that the trend is continuing, that it's flat and going down. A very good morning to you, Zama. Is it good news? Are the numbers still going down?
A very good morning to you, Peter, and our viewers. Great news. The numbers are going down, and South Africa is now the 9th worst affected country globally in terms of coronavirus cases. At number 1 is the United States of America, recording just a little over 7 million infections. At number 2 is India, recording a little over 5.6 million infections. Brazil at number 3 with a little over 4.5 million infections. Number 4 is Russia at more than 1.1 million infections. Colombia at number 5 with more than 770,000 infections. Peru at number 6, not far from there, with a little more than 770,000 infections. Mexico at number 7 with more than 705,000 infections. Spain at number 8, recording more than 680,000 infections, overtaking South Africa now at number 9. In the African continent, South Africa is still leading with infections, having passed the 660,000 mark. Let's take a look at the national COVID-19 statistics. More than 4.1 million tests have been processed in South Africa. More than 660,000 people have tested positive. More than 590,000 people have recovered, bringing the total to 89.1%. More than 16,200 people have since passed on from the virus. Looking at the infections in the provinces, yes, the numbers of new infections are decreasing, but 4 of the 9 provinces still reporting the highest numbers of infection, and these are provinces with big metros. Gauteng is still the epicenter of this pandemic. Let's take a look at these numbers. More than 218,000 people have tested positive in Gauteng. More than 118,000 people have tested positive in KwaZulu-Natal. More than 110,000 people have tested positive in the Western Cape. More than 88,600 people have tested positive in the Eastern Cape. As the country is now on level 1 of the lockdown regulations, and we see the numbers of confirmed coronavirus cases in South Africa going down, does this mean we are out of danger? Or like other countries, we might find ourselves on the second wave of this pandemic? Let's listen to what Minister of Health, Dr. Zweli Mkhize, had to say about this.
We are not out of the woods. The most important thing is that we still have about 10,000 patients, people who are positive per week. And we also know that there are more than the 10,000 who are infected, because the numbers are much higher. We're now searching for the vaccine. Before we get the vaccine, we can't rest. And so South Africans need to know that there isn't anything like level 1 is not like everything is over. Level 1 is just to say, let's try and rebuild our economy. That's all. Let's try and rebuild our social, religious, and traditions and everything that we have to try and bring ourselves back to normality. That's all it means. But the normality is a new normalcy now. It's no longer the same as before.
While it looks like the following provinces are recording the lowest numbers compared to provinces with big metros, the rate of infections is slowly picking up. Let's take a look at where they are. More than 45,000 people have tested positive in the Free State. More than 28,000 people have tested positive in the Northwest. More than 26,000 people have tested positive in Mpumalanga. More than 15,700 people have tested positive in the Northern Cape. More than 15,000 people have tested positive in Limpopo. Well, we are now on level 1 of the lockdown regulations, and more sectors of the economy are now opened and children are back at school. This doesn't mean that there is no more COVID-19. We need now more than ever to take extra care, South Africans. Let's continue to regularly wash our hands with soap and water, sanitize using sanitizers containing 70% alcohol content. We must also continue to wear a cloth mask that covers both our nose and mouth every time we leave our homes. We must continue to practice social distancing and ensure proper ventilation indoors, especially as more people are back at work. Yes, some borders are now open, but we must continue to limit our travel to only that which is absolutely necessary. If you believe there is a chance you may be infected with the virus, call ahead to seek medical help from your healthcare provider or use the public hotline 0800 029 999 and alert them to your symptoms. Thank you so much, and back to you, Peter.
Thank you very much indeed. It is good news about the numbers, but I think the most important message is that we have to keep on doing what we're meant to be doing, washing hands and all of that kind of thing, isn't it?
Sanitize, keep social distancing,
absolutely.
And limit our travel.
Yes.
We'll be okay. It's all in our hands.
You're so right, Zama. Thanks so much indeed. All right, now that's Zama with those statistics, but don't forget that as we observe and we report on these COVID-19 cases and numbers, these numbers can change and they can do so significantly, so just keep that in mind. Remember, you can also be a part of this program, and you can be asking our guests some questions that you might have, or you can even just share what's on your mind about what we're discussing. And the number to call is Johannesburg 714-5861 or 5877. That's 011-714-5861 or 5877. Vision loss is a decreased ability to see to a degree that causes problems not fixable by usual means, such as glasses. It also causes difficulties with normal daily activities such as driving, reading, socializing, and even walking. The question we're asking today is, are you living with an eye disease, and how well are you able to manage it? You can send us your voice notes or your video messages to our WhatsApp number, and that's 065 862 4548. And try and keep those messages quite short. Under 30 seconds is probably a good duration. And you can also share your thoughts with us on social media, and you can use our Twitter handle, which is @SABC Health Talk or #SABC Health Talk. You can also find us on Facebook, and there it's SABC Health Talk. And Health Talk continues right after this break. Stay with us.
For over 84 years, the SABC has been at the forefront of broadcast radio and television, bringing joy and happiness to the homes of many while continually redefining South Africa's media landscape. We do not speak with one voice. We let every voice in our nation find expression in language and in culture. We do not just bring the news, we provide content that is independent and impartial. We do not just broadcast sport, but we do it for the love of the game. We do not just entertain, we deliver local content, representing Mzansi for sure. We empower you with educational content that reminds you where you belong. With 19 radio stations and 5 TV channels, SABC 1, 2, 3, Education and SABC News Channel, we ensure that everyone in our nation is informed, educated and entertained. All the while knowing that at 84, there's still much more yet to come. Hashtag 84 years of SABC.
Welcome back. You're still watching Health Talk. Now, Claudette Medinfant, head of science at Retina South Africa, was diagnosed with retinitis pigmentosa damage to her photoreceptors. And it is an inherited disorder that results from harmful changes in any one of more than 50 genes. Now, these genes carry the instructions for making proteins that are needed in cells with the retina called photoreceptors. Some of the changes or mutations with genes are so severe that the gene cannot make the required protein, limiting the cell's functioning. Let's listen to Claudette as she tells her story.
Claudette, thank you so much for taking part on our show and welcome to the show.
Thank you for having me, Wandile, especially now because it's World Retina Week this week. So it's very opportune that I'm on your show.
Could you just kindly tell us about your eye condition? When did you first realize that you have an eye condition and when were you diagnosed?
I was a very little girl, about 5 or 6. We used to play in the street. Of course, we had no TV in those days, so all the children played in the street. And when we played all the naughty games like tok-toki or catch or something like that, I always walked or ran into the gutter or fell into the rose bushes. And then they realized I had that eye condition.
Also, kindly tell us about your symptoms. What symptoms were you experiencing?
So I can only see just a very limited field in front of me. And I also don't see poor contrast, black on brown or blue on green. You need good contrast. So it affects your mobility and your ability to move around with independently. Fortunately, I've still got some very narrow central vision, so I can see you and I can read my computer. But people with other retinal conditions can lose that central vision first.
Talk to us about treatment options. What treatment options did you go through, or did you go for eye operation, or were you on some type of medication?
Well, at the moment, we've got really no treatments for these conditions. Because they're genetic, it means you inherit them from your parents, and the mistake is in the genes, and that's a code for the eye to produce a certain protein. And if you've got that genetic mistake, the code is incorrect. And what the researchers are doing now are they trying gene therapy to try and correct that code.
Just a little bit information about Retina SA. What do you guys do and how can one be part of the organization?
Our website is www.retinasa.org.za, and people can go on to that website and get all the information, and even people who want to donate can donate to the research via that website. And there is a way that they can just leave their name and their email address, and we will email them. And we offer support and counselling and intervention to every South African with retinal vision loss. And we will help everyone that we can.
All right, and that's our focus today, isn't it? We're going to be taking a look at the various eye conditions, some of them preventable, treatable. And vision loss is a decreased ability to see to a degree that causes problems, not fixable by the usual means, such as perhaps wearing glasses. It also causes difficulties with normal daily activities, such as driving, reading, socializing, and even walking. Now, the question we've been asking is, are you living with an eye disease or an eye condition, and how well are you able to manage it? We'd love to hear your stories. Please send us your voice notes or video call us on 065 862 4548. That's 065 862 4548. You can also share your thoughts with us on social media, and that's at SABC Health Talk or hashtag SABC Health Talk. After the break, we speak to a specialist ophthalmologist about diabetic retinopathy, which is one of those common eye conditions that people sometimes get, and the impact of COVID-19, and a little bit later on, cataracts as well. So fasten your seatbelts and stay with us.
We are here in Zimbabwe. We're going to meet Zanupia.
To really address the Zimbabwe situation, you need to meet the stakeholders. And the stakeholders is the military.
Anything that can help to restore sanity in Zimbabwe will support it as the EFF. But to use the state resources by the leadership of the ANC, I think it was irresponsible.
I suspect what is going to happen is that the Defence Force and the Minister, they are going to take the blame for this.
The President has to act in the interest of South Africa and replace her with someone that can have the support and the confidence and the faith of the leadership.
Well, the ANC says that it will pay back the costs incurred to fly the party's delegation.
Cabinet decided that the country should now move to alert level 1. The move to alert level 1 will mean a further easing of restrictions on gatherings. The maximum number of people who may attend a funeral is increased from 50 to 100. Existing restrictions on sporting events remain in place. The sale of alcohol at retail outlets for home consumption is now permitted from Monday to Friday from 9 a.m. to 1700. We will be allowing travel into and out of South Africa for business, leisure, and other travel with effect from the 1st of October. The curfew will now apply between midnight and 4 a.m.
Welcome back. You're still watching Health Talk, and our focus today is on the eyes. Now, retinal disease is a leading cause of blindness, and early detection and treatment are key to slowing vision loss. Now, the eye is our most important sensory organ, and it's pretty complex and sensitive. Numerous eye diseases can have an impact on our vision and dire consequences for the way that we perceive the world around us. Now, this includes everything from harmless eye diseases such as chronically dry eyes and squinting to glaucoma, macular degeneration, cataracts, and diabetic retinopathy. Well, to talk to us about diabetic retinopathy, I'm now joined by Dr. Rob Daniel, who's a specialist ophthalmologist. Very good morning to you. Welcome to the program. Thanks very much for joining us.
Good morning, Peter. Thank you for having me.
All right, so diabetic retinopathy. I guess there's a clue there in the word diabetic and who's likely to get this.
Yes, absolutely. So as you are aware, in diabetes, there's too much sugar in the bloodstream. So our blood sugar being very high then tends to damage the blood vessels all over the body, but in particular in the eye is what we're interested in. So what happens is, if you think of the blood going through those vessels, it damages the walls of the vessels and then they become leaky. Then what happens is the body tries to heal them and they shut down and they either bleed and scar, and then they don't provide the oxygen required to the retina. So what happens then is the retina actually physically dies. And that's a blinding condition. So it's very, very important that we screen for that every single year. So every diabetic needs to have a a proper check by an eye professional once per year. Very, very important.
All right. There's different kinds of diabetes. There's the insulin insulin injections that people take on a daily basis, and then there's that other diabetes that is lifestyle related by and large. Which one is the one that's associated with the eye condition?
So we have what we call insulin-dependent diabetics, is normally type 1. Those people have an inherited condition where their pancreas doesn't make insulin. And then there's type 2, which is normally a lifestyle disease, which is normally seen in older folks, typically who have too much food available to them, let's put it that way. And those we can control mainly not with insulin. So in other words, oral hypoglycemics. Now, your risk for diabetic retinopathy is really a function of how long you've had the diabetes and how severe the diabetes is. So in childhood diabetics, which are typically type 1, they've had it almost from birth. So they tend to present much earlier and at a younger age with diabetic retinopathy. However, if you have type 2, which is seen in middle-aged people and older, a lot of the time these people don't know they're diabetics. So they're living with a high sugar, and then the retina gets damaged, and that may even be the first presenting symptom.
Is diabetic retinopathy something that's progressive over time, and is it manageable?
Well, it's definitely a function of sugar control. So if your sugar control is good and on a daily basis there isn't too much sugar in the bloodstream, your risk of diabetic retinopathy is very low. So again, it's a function of how long you've had the disease and how well you control the disease. But certainly, if you control the disease well, you don't get diabetic retinopathy. So it is manageable, it is controllable, and most importantly, it doesn't happen overnight. And that's why these annual checks are so important, because we can, for months in advance, see the problems coming. So if we check you once per year, we will anticipate problems and avoid them and treat them and manage them, and then effectively you would never go blind from the condition.
All right, so that is good news, isn't it? And I guess the key is, as soon as you know you're diabetic, go and get tested regularly, and you can manage it from that point on. It doesn't need to get worse, as it were.
Yes, absolutely. We have very effective treatments. And the screening process literally takes a few minutes, once per year. Remember that your vision, your input to your brain, 80% of all input to your brain comes through your eyes. This is your most valuable sense. So once a year for a visit is an absolute a must.
All right. Okay, there are a number of eye conditions. Later on, we're going to talk about cataracts, but perhaps let's just touch on these other ones. Refractive errors, that one I know quite well because I wear glasses, and that's usually to do with the shape of your cornea in your eye, isn't it?
Yes, so it's the most common eye condition. 59% of us around the world have some or other refractive error, so that means that the light is not bent appropriately to focus the image on the back of the eye. And that can be corrected with glasses, contact lenses, and most effectively with laser. So the laser technology is amazing today. So all of those conditions are common but treatable.
All right. What about age-related macular degeneration? Talk to us about that.
So in medicine, the name normally tells you, a lot about the condition, and age implies that we see this in older folks. The macula is the part right at the back of the eye, which focuses the light and sends the image to the retina. And with poor diet and too much light exposure, and over a period of years, that part of our retina becomes degenerated or aged, and that causes a loss of central vision. So if you're looking at my face would be blurry and the outside would be okay. and that's very debilitating for people, and it's preventable. So again, annual eye checks to see these things coming, because there are supplements that you can take to prevent and avoid age-related macular degeneration.
All right, so let's talk about glaucoma. That's something that we hear about quite a bit as well.
Glaucoma is a very important disease. It's the second commonest cause of blindness on Earth, and it's the most common cause of irreversible blindness. In Africa, we have an incidence of 9%. That's almost 1 in 10 people have glaucoma. The frightening thing about glaucoma is it does not have any symptoms. You could have it, and if you haven't been tested, you wouldn't know until it's too late. So again, testing is so important. And what glaucoma is it's damage to the optic nerve at the back of the eye, the part that takes the message from the retina to the brain. It's typically associated with pressure, but not always. And what happens is the nerve gets damaged, and in this condition, the outside of the vision gets affected first, which means you get tunnel vision, and you end up with just this tiny little central portion and then eventually nothing. So a very, very important condition to test for on an annual basis.
All right, and that's even if you don't wear glasses, go and get tested, just as
every single person.
Okay, and then amblyopia, and I guess it goes with strabismus as well. Talk to us about those two.
So amblyopia means a blind eye which is normal. And so it's an anatomically normal eye that doesn't see. And that is also a very important condition. 7% of our population have one eye which looks normal but doesn't see. Now, what that is typically due to is a lack of focus in that eye. And up to just a couple of years ago, we could not test for this. But today we have very effective screening technology, which can, with a 1-second photograph, screen a child up to from the age of 6 months, but up to any age for this condition. Now we should get the screening done before the age of 3. So again, parents need to inquire and make sure that their children are tested, because if we pick this up, the very simple test, we can avoid it and prevent it completely. And that 7% of the population with one blind eye will just be fine. Now that one blind eye often goes off tracking, and we call that a strabismus, which is a squint. Okay. So 95% of squints are related to the eyes not focusing as a very small child. So when we're growing up to the age of 3 is the time that we do the biggest increase in all our development, and we develop all of these senses, including the vision. So we need to be tested before the age of 3.
All right, so we're going to take a break, but we'll be back to talk specifically about cataracts. But so far, the moral of the story really is check at least once a year your eyes as well. We're checking other parts of our body, but the eyes, we can prevent a lot of sadness if we just do the checks.
Absolutely.
All right, okay, stay with us. We'll be back right after this. After the break, we continue, as I said, this discussion with Dr. Rob Daniel, specialist ophthalmologist, and we'll be focusing on cataracts and the impact of COVID-19. Stay with us.
Look at Hello, Rodney.
Hi, Kutleko.
Where are you?
I'm just driving to work.
Tell me about what it is that you do for a living.
I manage hospitals in the private sector.
You guys are out there saving lives, but I want to talk a little bit about how you saved money with insurance.
I spoke to a consultant by the name of Shane Peterson. Cross-examined him a few times. I was shocked at the fact that I was going to be saving 435 Rand on my policy. Basically, chencha dadeng.
SMS saved 44211 or call 08 600 60,000 and chencha dadeng.
In the trenches of business, don't lose sight of the bigger picture. With Nedbank's investment expertise, we'll help structure innovative solutions that will provide optimal returns. To guide your growth, search Nedbank Bigger Picture Business Banking.
Rice doesn't get better than this. Speckle.
Welcome back. You're still watching Health Talk and our focus on eye care today. Now, you might be wondering, what are cataracts? Well, these are progressive, painless clouding of the natural internal lens of the eye. And cataracts block light, making it difficult to see clearly. Over an extended period of time, cataracts can cause blindness. The exact cause of cataracts is unknown. They're often related to growing older, but sometimes they can develop in younger people. Babies even sometimes are born with cataracts, also congenital cataracts, or children may develop them as a result of injury or illness.
Karpen Pillay is going blind. His eyes have grown cataracts, bringing with them a creeping darkness and a terrible despair.
Can't even read the name of the horse. I felt like I lost my hope. I lost hope in everything. I thought I just lost my life. That's what I thought.
This is Umpumulo District Hospital in KwaZulu-Natal. It's one of the few rural hospitals with a fully equipped eye clinic. In a country where thousands are losing their sight due to cataracts, a simple operation is all that it takes for the blind to be able to see.
bese ngene kakhulu ngoba bengike ngithi mangithi ngiyahamba mhlambe indawo kube sangazathi iphakeme mina mangithi ngiyabuka kanti ayiphakeme kwesinye isikhathi bengithi mangithi ngiyakhuphuka emastebhisini uvele kube mnyama emehlweni ngivele ngiwe.
Cataracts are a condition where the lens inside one or both eyes grows gradually cloudy. As it progresses, vision becomes dimmer and more blurred until it becomes impossible to see anything at all. Unlike other eye diseases, it can be easily operated and cured, but few public hospitals have the staff or capacity to cope. So private medical providers have joined government efforts by bringing cataract surgery to remote rural areas.
Angade ngithunga idwaba ngilokhuza ngiluka amacansi manje angisakwazi.
Some they are having a lack of knowledge where they don't know what to do. They are living with blindness years and years, and I go there and tell them about the cataract and how to treat cataract, and some is very much difficult to convince them that, and some they told me that, oh, even my father was dying like this, so I'm not going to do that thing that they were telling me.
We lack the eye care personnel to appropriately screen, counsel and refer people. Many of the primary healthcare nurses are doing their best but often we need more people to support that. Most of these rural outlying hospitals don't have the surgical facilities or the ophthalmologists to be providing the service. The number of ophthalmologists in our public sector is too little to have that kind of outreach that we need within the public sector.
Over 3/4 of all blindness worldwide is preventable and usually caused by cataract. Cataract is the leading cause of blindness in South Africa, responsible for about 50% of the prevalence of blindness and identified as a national health priority. Cataracts are very common as you get older and are rarely dangerous. After a number of years, they'll likely affect vision. And by age 65, over 90% of people have a cataract, and half the people between the ages of 75 and 85 have lost some vision due to cataract. We continue our discussion on eye conditions with Dr. Rob Daniel, a specialist ophthalmologist, and we focus this time on cataracts. Dr. Daniel, so cataracts, I mean, it just sounds so sad that a simple operation and you're fixed. And so the challenge really is to get to as many people as possible, but the first step is understanding that there's a problem. What are the symptoms that you might have a cataract issue?
So the first thing naturally is a decline in your vision. That is slow, and it happens over a period of time. Normally what happens is people sort of adapt to the declining vision by doing less night driving or perhaps changing their way they live. But eventually what happens is the vision then becomes so poor that they can't manage on a daily basis. Often one of the earliest symptoms is a problem with night driving and sometimes double vision. So those are much earlier symptoms, but it doesn't normally happen overnight. It's a slow process.
And no matter how much it's progressed, it is reversible through an operation. Is that correct?
So a cataract operation is really a wonderful thing to be involved in. Firstly, it's the safest operation in the history of medicine. You're safer with us having a cataract operation than you are in the car on the way to the cataract operation. And because we're replacing the cloudy lens and we put an artificial one in its place, you literally go from being functionally blind to the very next day having completely normal vision. And that, by the way, is permanent because that lens then remains clear for the rest of your life. So it really is a dramatic change and a wonderful thing to have.
The numbers we talked about seem to be quite high, and I guess this puts a strain on the public health system, and this ends up with people on long waiting lists, but also unnecessary blindness.
Yes, and this is a worldwide problem. As our populations become older, as you mentioned before, cataracts are definitely a function of age. As we go through life, the lens becomes progressively more cloudy. And if you think about the bathroom window, it's frosted. They just can't transmit the light anymore. So as one gets older, the lens becomes cloudy, and that means it needs to be replaced. The trouble is that the technical requirements for doing the operation require a number of years of training, 14 to 16 years to be a specialist ophthalmologist. And then the other equipment and technical devices we require for that operation are not only expensive, but very technically orientated. So that means that it's expensive and that it's in short supply. So that we just can't get enough of these operations done to provide for the whole population.
All right. We keep talking about as you get older. Does this mean that there's a natural propensity for most people to develop a cataract of some kind over time?
Oh, without a doubt. So the growth of the lens, so behind the iris, the colored part, the hole in which is your pupil, sits the natural lens. And that natural lens is what allows you to focus before your mid-40s. But that lens grows like an onion. It gets bigger and bigger as you get older. But at the age of 50 years old, it can only transmit 70% of the light that it would normally have. And that's just a function of aging. By 60 or 65, it's actually got to the stage where it's not allowing the light through, and that is a visually significant cataract. So yes, there are other causes, including trauma and diabetes and various other conditions, but the vast majority of cataracts are just a simple function of age. And because it's the most common affliction of humankind, we need to try and make the system far more efficient to allow people access to having this operation, simply because you go from being a non-functional, effectively blind person back to a normal life.
All right. Is there a point at which you say, this is the best time to do the cataract operation, or as soon as you're diagnosed, get it sorted? You know, are you waiting until you get to a certain level of difficulty, or do you do it straight away?
Yes, that's a common misconception that was inherited from when the operation wasn't as sophisticated. So you almost had to earn your cataract by it being ripe or mature, and that was a function of you needing the operation in balance to its risks. But today the risk of the operation is so low that it is insignificant. But again, it would be based on your situation. So if you're in a service where you're trying to help as many people as possible, you obviously want to try and do the most visually significant cataracts first, so that those people are helped earlier. Technically, the earlier you do it, the softer the lens, which makes it easier for us to perform the operation and therefore lower risk. So we don't like to leave the cataracts to becoming too hard, otherwise it increases the risk of the operation. So by all accounts, the sooner the better.
All right, so let's say you get your cataracts replaced at 45, let's say. Does that mean for the rest of your life you don't need to do any more corrective surgery?
So normally what happens is the lens is what changes in the eye. So your changes that you experience over the years are due to the lens growing. Typically, we wouldn't do a cataract operation on a 45-year-old. There are some reasons that we would, but normally you would have it over 55, around about 60 years old. And to answer your question about the longevity of the cataract operation, we have at least 60 years of data on the lenses that we use. And there's nothing in that data to show that it wouldn't last longer. So I always say, please God, that's not long enough. But for all intents and purposes, the cataract operation is permanent.
All right. And then they say that, and we see it often, as we get older, we start to wear glasses, sometimes to read. Once you've had the cataract operation, might that still be something you may face?
So that's actually my subspecialty. I'm a refractive surgeon, and I specialize in allowing people to not need glasses pretty much at all. If you have a standard cataract operation with a normal intraocular lens, yes, you will wear glasses. Whereas the technology today allows us to give you a full range of vision, but that requires a more sophisticated lens and a far more sophisticated approach, which naturally adds costs. So I think, that's definitely for people who would want that. But if you're in a position where you actually can't see, a pair of glasses really isn't a big deal afterwards.
No, definitely not. We have a caller on the line from Durban. Hello, caller? All right, okay. We're hopefully going to get a caller who might be able to ask a question. But is cataract, it's not preventable. It is just one of those things, I guess.
Yes. It's a bit like aging. We're desperately looking for that elixir that's going to stop us from aging. And you might see some false news about eye drops that can prevent cataracts and all of that. It's absolutely untrue. If you go through life, which is a euphemism for aging, you will develop cataracts.
All right. I mean, the good news and the relief, I guess, is that this isn't something we need to worry about. It is something that once we spot it, we manage it. And again, going back to our earlier conversation, we need to have these eye checks all the time.
Absolutely. So in today's world, a cataract operation is a very civilized, painless morning visit to the hospital, and you recover your vision within 1 day, and it's all over. We don't even use stitches in the operation. So having the cataract operation isn't really the issue. The main thing is, as you said, we need to go for those annual eye checks because there's so many what we call asymptomatic diseases in the eye, which we look for and then we try and avoid and prevent them. And then maintain your vision to its optimal quality throughout your life.
All right, so we've got a caller, and it's Cecilia, I believe, from Soweto in Johannesburg. A very good morning to you, Cecilia. What question do you have or thought you want to share? Oh, dear. Okay, we've lost Cecilia as well. I'm not sure what's happening today. I think they've seen you and they got worried. All right, so, eye care generally, we've talked about cataracts, diabetic retinopathy and some of the other conditions. But perhaps as we start to close up, as a specialist ophthalmologist, what would be your best advice, apart from the checks, to people about these conditions, because I get a sense that most of them need not be feared.
So I think we live in quite a harsh environment. So wearing sunglasses outside is always a good idea. We see a lot of problems with overexposure to UV light. And that's a fairly easy change that you can affect. Healthy diet, and go for your annual general health checks, because remember, the eye is part of your body, and whatever your general health is going to affect your eye. And then eye protection, that's another big one, both in industrial environments, in sport and at home. Be aware that a simple pair of goggles could avoid a whole lot of pain with an unfortunate accident.
All right, Dr. Rob Daniel, thank you so much. It's been great talking to you and giving us so much valuable information. Thank you so much.
It's a great pleasure. Thank you.
All right, that was Dr. Rob Daniel, a specialist ophthalmologist. So there you have it. So many things that you can do. You don't need to fear. But bottom line, you really, really need to make sure that you're getting those checks done because some of those issues can be dealt with quite quickly and simply. And be cool. Wear sunglasses. After the break, we speak to a GP who joins us to give us advice on COVID-19 related issues. A lot of people are going onto social media and you never know whether you can trust those answers there. So hear it from a doctor after this.
Cabinet decided that the country should now move to alert level 1. The move to alert level 1 will mean a further easing of restrictions on gatherings. The maximum number of people who may attend a funeral is increased from 50 to 100. Existing restrictions on sporting events remain in place. The sale of alcohol at retail outlets for home consumption is now permitted from Monday to Friday from 9 a.m. to 1700. We will be allowing travel into and out of South Africa for business, leisure, and other travel with effect from the 1st of October. The curfew will now apply between midnight and 4 a.m.
All right, welcome back. We're starting to wrap up the program, and as we do every week at this time, is we talk to a real GP to give us real solutions about some of the things that might concern you. We're waiting for a vaccine. Some of you are getting COVID and have got symptoms at home, and you're going online and trying to get advice, and sometimes it's not the best advice. So use this opportunity to get some real answers. And let's get some questions answered with our resident GP, Dr. Marlon McKay. A very good morning to you. Great to have you on the program again.
Good morning, Peter. Thanks for having me again.
All right, okay, let's go straight into it. Julia Brooks says, which day does the symptoms get the worst? I'm on day 2 and I feel like my COVID symptoms are pretty bad. I'm scared about them getting worse. I really have a bad cough and a sore throat, and I'm very tired. I keep reading that day 7 and 8 is the worst, so that's making me so nervous.
Yeah, so it's absolutely true that usually the middle part of the illness, day 7, day 8, one can take a bad turn. That's mostly for those who are at very high risk of severe illness. So those with comorbid conditions, those with obesity, chronic kidney disease. So sometimes it's a good thing that you get sick or feel worse sort of earlier in the illness, and you may not really worsen. But just be prepared around day 7, 8, day 9 for some worsening of symptoms, and be prepared for that. Have your doctor on standby.
Okay, but I guess it's going to be different for different people, isn't it?
Absolutely, and it all comes down to one's immune system. And this is why you can get 2 people infected with the same virus. One dies, one doesn't. One gets severely ill, one ends up in ICU. And we just don't know. We think it's due to the reaction of your immune system. Those who have an exaggerated immune system, an over-responsive one, is where everything goes just haywire and goes crazy, and you land up with all these complications in hospital.
All right. Timothy Wayman says, hi, everyone. Just wondering if anyone had scar tissue built upon their vocal cords after being on the ventilator. Mine is so bad that I can't breathe right. Having surgery in 2 weeks' time to have a tracheostomy put in and then later have the scar tissue removed. Has anyone had this done? Did it work? Is this a common consequence?
So fortunately, it's not very common. And this is why with most of our patients, if they do land up in ICU, we use what we call NIV, non-invasive ventilation. So it's not an invasive thing down the throat. And unfortunately, in some patients where they've had it really, really bad or severe illness, they've had to be mechanically ventilated. And depending on the duration and the type of ventilation, they can land up with this sort of thing. So it is a sequelae or complication of the ventilation. But the procedure is the right thing. That's what they're going to do, and try and get off some of that scar tissue in order to get the voice back. It's unfortunate, but it does happen now.
All right, let's get one last question in. Loveness Skosana says, I have a question. I tested positive for COVID and I'm on day 10. I'm not coughing too much, but chest feels very dry. What can I use? And does it always mean you've developed pneumonia if you have shortness of breath, or is it just a symptom of this monster virus?
Yeah. So shortness of breath is not always a symptom of pneumonia. It's together with a bad cough or productive cough, usually coughing up blood, and usually with the high temperature and that feeling of suffocation. So it's unlikely to be pneumonia. Remember, by day 10, the worst of the illness is over in most cases. You're no longer shedding virus, so you're not even infectious anymore. But you can still have some symptoms, like the cough, which may persist for weeks. The shortness of breath may persist for weeks. I would suggest if there's no acute worsening, you'll probably be okay, but it may not recover by tomorrow. It may still take a few days, if not weeks.
All right. Dr. Marlon McKay, always a pleasure. Chat to you again soon. Thanks so much. All right, and that's where we come to the end of today's program. Thanks very much indeed for watching. Don't forget to join us next week at the same time. And in the meantime, we're in level 1, but that means we must be even more vigilant. Wash your hands, sanitize them, social distance, stay at home as much as you can, and don't forget to wear those masks every time you leave the house. I'm Peter Ndoro. Have a great week. Bye-bye.
Did you know that as a valid TV license holder, you can now win your share of R500,000 in daily prizes? Yes, you only have to renew or pay your domestic TV license. Then dial *120*45887# or visit tvlicgames.co.za and take a chance at our Wheel of Fortune Spin and Win or Scratch Pad. Enter to win award-winning giveaways such as airtime, shopping vouchers and household appliances. Dial *120*45887# or visit tvlicgames.co.za to enter now. Terms and conditions apply. USSD 20 cents per 20 seconds, R1.50 per entry. T's and C's apply. TV licenses, making more content possible every day. #made possible by you.
Throughout the course of global history, humans have proven time and time again that a single act by a single person